Hello, my name is Danyelle Minor, and this is my final presentation on ADD/ADHD. This presentation will go over what ADHD is, why it is important to study, the symptoms and behaviors demonstrated, as well as the lifespan, the statistics, research done, the brain's role, the neurotransmitters' roles, and the hormones' roles in ADD and ADHD. Attention deficit disorder, or attention deficit hyperactive disorder, is a neurodevelopmental disorder defined by observations of behavioral symptoms, such as inattentiveness, hyperactivity, and impulsivity. These characteristics are common in children, but a diagnosis of ADD/ADHD can be made when these characteristics start to interfere with the child's ability to learn. Now, why study ADHD? ADD/ADHD is an important topic to study because it is the most common behavioral disorder presented in childhood. This disorder is prevalent in about 5% of children in most cultures, and about 60% of those children continue to display symptoms into adulthood. Many children go without a diagnosis because it is often too difficult to diagnose, since the symptoms are not very well defined. Adults with ADD/ADHD are likely to show cognitive impairments and less likely to attain an occupation due to their educational struggles. Now, I know this looks intimidating, but don't let it scare you. These are just the symptoms. The symptoms of ADD/ADHD are caused by a deficit, damage, or decrease in activity in the prefrontal cortex, the striatum, or the cerebellum. The DSM-5 requires that for at least 6 months there is a presence of at least 6 out of 9 symptoms of inattention or 6 out of 9 symptoms of hyperactivity and impulsivity. Inattention can be described in many ways, but the DSM-5 defines it as fails to give close attention, difficulty sustaining attention, doesn't seem to listen when spoken to, doesn't follow through on instructions, difficulty organizing tasks, avoids sustaining mental effort, loses things necessary for activities, often is distracted, and often is forgetful. Hyperactivity and impulsivity is defined as often fidgets with hands or feet, difficulties staying seated, often runs around or climbs excessively, difficulty playing quietly, often is on the go or often acts as if driven by a motor. They talk excessively. They often blurt out answers before the question has been completed. Difficulty awaiting turn and often interrupts. Now, the behavioral symptoms expressed in those with ADD/ADHD are the results of a delay of reinforcement gradient. ADD/ADHD is oftentimes correlated with aggression, learning disabilities, depression, conduct disorders, anxiety, and low self-esteem. Now, when we talk about the lifespan of ADD/ADHD, we're talking about how this disorder is impairing their lives, how it affects their social well-being or their emotional well-being. Because of social impairments, children can feel sad or show oppositional or aggressive behaviors from family issues. Family issues can include parents not knowing how to handle a child's outbursts or inattentiveness or impulsivity. Now, children with ADHD tend to be more hostile, less responsive, and more avoidant towards their parents or other authority figures. Children and adolescents with ADHD tend to be self-centered, impulsive, intrusive, commanding, and hostile towards peers. They are also more likely to be disruptive of ongoing interactions with others, and they will show off and joke around more often in social settings. They also express anger and frustration more, and show less empathy and guilt. Although this may not be on purpose, it is a part of their social impairments and should be taken into consideration when interacting with someone who has ADHD. Those with ADHD, especially children and adolescents, have poorer social and communication skills. Those with comorbid disorders have even greater social difficulties, including more severe ADHD symptoms, peer problems, and family distress. Children and adolescents struggle to maintain friendships due to their inability to perform social exchanges, like sharing, cooperating, and taking turns. More often than not, children and adolescents with ADHD are less liked by peers, they're rejected more, and have fewer reciprocal friends, which leads them to affiliate with deviant peer groups. Now, as far as teenagers and adults, those with ADHD tend to be sexually active at a younger age, usually have more sexual partners, and spend less time with each partner. As a result, teenage pregnancy is greater in those with ADHD, and they have a 4 times higher risk for sexually transmitted diseases. Now let's talk about emotional impairment. Emotional impairments for those with ADD or ADHD include poor self-regulation of emotions, greater excessive emotional expression, having a harder time coping with frustrations, being less empathetic, and a decreased arousal to stimulation. Those with ADHD are known to have low self-perception, meaning low self-esteem, self-worth, self-confidence, and academic and social self-esteem. Those with comorbid anxiety or depression tend to worry excessively about their competency. They are usually tense and quick to panic. They constantly need reassurance. Or they may avoid interacting with others entirely due to being shy and having social phobia. Overall, those with ADHD are likely to experience academic failure, peer rejection, family conflict, parental hostility, accidental injuries, poor occupational achievements, marital strife, or loss of driving license, on top of the emotional problems that are a part of ADHD. Now on to the statistics. 6 years old is the median age of onset for children with ADHD. Studies showed that diagnosis in children ages 4 to 17 have increased by 42% in the span of 8 years. The lifetime prevalence of ADHD in adolescents aged 13 to 18 was 8.7%, but the lifetime prevalence of adults ages 18 to 44 is only about 4.4%. Now, ADD/ADHD is 10 times more prevalent in young boys than in girls. However, in adulthood, the ratio is roughly 2 to 1, meaning girls are simply less likely to be diagnosed in childhood. In adolescence, or in teenagers, males were affected 3 times more than females, which is far less than the 10 times more in childhood. But by adulthood, males were only 2.2% more likely to be diagnosed with ADHD than women. In adolescence, there is no difference in prevalence of ADHD between ethnicities, cultures, or races. However, in adulthood, the prevalence of ADHD for whites is 3.3% higher than Hispanics and 3.5% higher than Blacks. Now, what kind of research has been done? Twins and family studies have indicated that heritability of ADHD ranges from 75 to 91%. Functional imaging studies showed that ADHD is caused by changes in the caudate nucleus and putamen in the striatum and changes in the prefrontal cortex. Genetic testing has discovered that 2 variants of an enzyme, COMT, can determine if the ADHD is treatable with amphetamines. The Val-Val variant of catecholomethyltransferase, or COMT, shows those who have lower brain levels of catecholamines respond better to low doses of amphetamines to treat ADHD. The MET-MET variant shows that those who have higher brain levels of catecholamines have a negative response to an amphetamine treatment. Now let's dig into the medications. Now more than ever, children are being diagnosed with ADD/ADHD. In less than 10 years, the prevalence of children diagnosed with ADHD has increased by 42%. Almost 70% of those children receive medication for ADHD. Medications used to treat ADHD are separated into 2 categories: stimulants and non-stimulants. The most common or well-known FDA-approved stimulants used are Adderall, or dextroamphetamine, and Ritalin, or methylphenidate, MPH. The medication that is recommended when Ritalin is not optimal is Vyvanse, or lisdexamfetamine dimesylate, LDX. Ritalin and Adderall are commonly abused drugs. Vyvanse is a medication that alone is pharmacologically inactive, but once orally administered, it is converted to an active form of the drug. This is important because it means it won't be sought after as a recreational drug, as most recreational drugs can be administered in several different ways, such as snorting, injecting, melting, etc. Vyvanse is also important because it is the first stimulant to increase the duration of efficacy from 2 hours to 14 hours in adults. This is a big improvement for those diagnosed with ADD or ADHD. LDX, or Vyvanse, is transformed into an active drug by rate-limited enzymatic hydrolysis to L-lysine and D-amphetamine after oral administration. LDX has a central nervous system stimulating activity, which regulates the reuptake and release of catecholamine on the synaptic cleft. LDX targets 7 human proteins that are involved in the presynaptic signaling and thereby aiding in the role of regulating DA, or dopamine, NE, norepinephrine, and SE, serotonin, pathways. LDX also acts as a neuromaintenance agent because it inhibits MAOA and MAOB, oxidative enzymes. Now let's take a look at the brain's role in ADD/ADHD. Let's start with the prefrontal cortex, as it is in control of several ADHD symptoms. Typically, the prefrontal cortex is a region of the frontal lobe that is near the front end of the motor association cortex, which is involved in formulating plans and strategies. However, the activation of the prefrontal cortex is decreased in those with ADHD, which causes a deficit in working memory, regulating emotions, actions, and thoughts. Working memory is used by the prefrontal cortex to direct thoughts and behaviors, manage attention, observe the impact of our actions, and compile plans. Losing things necessary for activities and being forgetful are the inattentive symptoms caused by the prefrontal cortex as they relate to working memory. Hyperactive and impulsive symptoms, like often fidgeting and having a hard time playing quietly, could be caused by difficulty in regulating emotions in the prefrontal cortex. Damage in the neural circuits that perform the functions of the prefrontal cortex enhance the symptoms of ADHD, meaning ADHD symptoms resemble those produced by damage to the prefrontal cortex. It is shown in a study that those with ADHD have a decrease in the amount of restriction on water diffusion in different tissues that are associated with the connections between cognitive control and attentional cortical networks, such as the right superior longitudinal vesiculus connecting the inferior parietal lobule and lateral prefrontal cortex. Now, what about the striatum? The ventral striatum is in control of the effects of reinforcing stimuli on learning, as well as decision-making and the planning and execution of movements. With a lack or decrease in motivation caused by the striatum, those with ADHD experience difficulty sustaining attention, not following through on instructions, and avoiding sustained mental effort. The function of decision-making is also affected by the striatum, causing hyperactive or impulsive symptoms like having difficulty staying seated, often running about or climbing excessively, often is on the go or acts as if driven by a motor, impatience, and oftentimes interrupting. Some believe that ADHD is caused by the changes in the caudate nucleus and putamen network within the striatum, and changes in networks in the prefrontal cortex, which connects to the striatum. It has been proven that the activity in the right ventral striatum decreases when those with ADHD are anticipating a reward. A study showed decreased activity in the right ventral striatum during anticipation of reward in children with ADHD and an increased sensitivity to parent-rated rewards. It's been predicted that children with ADHD show behaviors focused on short-term reward as a way to normalize dopaminergic neurotransmission in the striatum. Now, lastly, but most importantly, the cerebellum. The cerebellum is the main region of the brain that is affected by ADHD. Typically, besides motor coordination, the cerebellum has functions such as executive functions, attention, language, and cognitive processing of emotions and negative stimulus. So lack of attention to detail, not listening when spoken to, unorganization, and often being distracted are the inattentive symptoms of ADHD that are caused by the cerebellum as they relate to executive functioning and attention skills. And since language is a function of the cerebellum, the hyperactive or impulsive symptoms are excessive talking and blurting out answers prematurely. The functional connectivity values in those with ADHD were observed to be higher than others in 4 brain regions: the left middle frontal gyrus, the right middle frontal gyrus, the right superior temporal gyrus, and the left parahippocampal gyrus. The left middle frontal gyrus functions include, but are not limited to, decision-making and working memory. The right middle frontal gyrus functions include attention reorientation and network regulation. The right superior temporal gyrus functions include, but are not limited to, spatial processing and social perception. And the left parahippocampal gyrus functions include spatial processing and memory functions. So in those with ADHD, the cerebellum is smaller and activation levels are significantly lower. The higher levels of internal changes in functional connections could lead to the decline of the ability to maintain continuous attention. Activation of the left and right middle frontal gyrus decreased and cerebellum activation increased. Enhanced functional connectivity between the cerebellum and the left and right middle frontal gyrus could cause disorganized connection networks, leading to attention deficit, weakened working memory, and lowered decision-making functions in those with ADHD. Enhanced functional connectivity between the cerebellum and the right superior temporal gyrus can reduce spatial perception, emotional attention and visual exploration, and rash processing of social emotions, which could explain the impulsiveness of children with ADHD. Enhanced functional connectivity between the cerebellum and the left parahippocampal gyrus may result in odd emotion management mechanisms, along with poor control over emotions and anger. How do neurotransmitters play a role in ADD or ADHD? So both dopamine and norepinephrine have a large effect on the prefrontal cortex. So these neurotransmitters are vital to the development and treatment of ADHD. Research on schizophrenia has led scientists to conclude that ADHD is caused by the underactivity of dopaminergic transmission. It has also been proven that the levels of dopamine produced in the prefrontal cortex have effects on behavior. It is said that those with ADHD may have two different variants of a gene for an enzyme, catechol-O-methyltransferase, or COMT, that breaks down catecholamines like dopamine and norepinephrine, which has an effect on behavior. These two variants of the enzyme can determine if the ADHD is treatable with medications like amphetamines. Amphetamine is a dopamine agonist, which can reduce ADHD symptoms, but only for those with the Val-Val variant of COMT. Hormones that are involved in ADD or ADHD. So prenatal organizational effects of testosterone can affect dopaminergic circuits in the striatum in a way that puts boys at greater risk for early development of externalizing disorders like ADHD. And activation and inactivation effects of estradiol at puberty may modify amygdalar and other circuitry, affecting serotonergic pathways, possibly placing girls at greater risk for developing internalizing disorders like anxiety. Estrogen can affect neurotransmitters, specifically dopamine, serotonin, and norepinephrine, which play a key role in ADHD by impacting memory, focus, and mood. Research mentioned in a Healthline article states that higher levels of estrogen can improve attention and executive thinking skills, and lower estrogen levels can worsen ADHD symptoms. It was also proven that during puberty, unlike estrogen, higher progesterone levels do not improve ADHD symptoms. And throughout the rest of a menstruating woman's life, those levels increase during the last 2 weeks of her menstrual cycle. And that concludes this presentation on attention deficit disorder and attention deficit hyperactive disorder. Thank you for watching and have a great day.